Hey there, America. Let's talk healthcare. It's a mess, right? We all know someone who has struggled with medical bills or has had to make tough choices because of healthcare costs. We spend more than any other developed country, yet millions are uninsured or underinsured. It's a paradox that leaves many scratching their heads. How can we be spending so much and still leaving so many people behind? It doesn't have to be this way. Imagine a system where everyone has access to the care they need without the fear of financial ruin. A system where healthcare professionals can focus on patient care rather than paperwork and billing. Countries like Brazil and the UK have figured out how to provide free healthcare to their citizens. They have their own challenges, but they have managed to create systems that prioritize the health of their people. They faced challenges, sure, but they also found solutions. They navigated political hurdles, economic constraints, and logistical issues to build systems that work for their populations. So, can we learn a thing or two from them? Absolutely. We can study their successes and their failures to build a system that works for us. You bet we can. But it will require a collective effort from all of us, policymakers, healthcare professionals, and everyday citizens. Now, I'm not saying it's going to be easy. There will be obstacles and opposition. Change is never simple, especially when it involves something as complex as healthcare. Transforming the U.S. healthcare system will take a massive effort. It will require us to rethink our priorities and make some tough decisions. We're talking about changing laws, restructuring government agencies, and maybe even having an honest conversation about taxes. These are not small tasks, but they are necessary if we want to create a fair and effective healthcare system. But hey, if we can put a man on the moon, surely we can figure out how to provide basic healthcare to everyone, right? We've tackled big challenges before, and we can do it again. This isn't about socialism or handouts. It's about creating a system that works for everyone, not just the wealthy or the lucky. It's about fairness, about ensuring that everyone has a chance at a healthy life, regardless of their income or job status. It's about creating a society where people don't have to choose between paying rent and getting medical care. It's about time we stop treating healthcare like a privilege and start treating it like a right. Everyone deserves access to quality healthcare, and it's up to us to make that a reality. So, buckle up, America, because we're about to embark on a journey to explore how we can transform our government and finally achieve free healthcare for all. It's going to be a long road, but together we can make it happen. Let's get started. All right, let's get down to brass tacks. The journey to free healthcare begins with a solid foundation, and that foundation is the law. To make free healthcare a reality, we need to start with the law. Laws are the bedrock upon which we build a fair and equitable healthcare system. Just like Brazil's Sistema Único de Saúde, SUS, and the UK's National Health Service, NHS, we need comprehensive legislation that guarantees healthcare as a fundamental right. These systems didn't appear overnight. They were meticulously crafted through robust legal frameworks. This means creating a clear legal framework that outlines how healthcare will be funded, delivered, and regulated. It's about setting the rules of the game so that everyone knows their roles and responsibilities. This isn't just about passing a law and calling it a day. It's about creating a living, breathing document that evolves with the needs of the people. We need to ensure that this legislation has teeth. It must be enforceable and have mechanisms in place to hold all parties accountable. It needs to establish strong regulatory mechanisms to prevent insurance companies from weaseling their way out of providing coverage, and to ensure that everyone has access to the same standard of care. This means no loopholes, no exceptions. Remember, this is about creating a system that works for everyone, not just those who can afford it. It's about equity and justice in healthcare. This means ensuring that everyone, regardless of their pre-existing conditions, employment status, or income level, can access the care they need without going bankrupt. It's about peace of mind and security for all. And let's not forget about funding. A law without proper funding is like a car without fuel. It won't go anywhere. We need to establish a sustainable funding mechanism that ensures healthcare is adequately financed and accessible to all. This could involve a mix of public funding, taxes, and other innovative financial solutions. More on that later. Now, let's talk about the role of our government. We're not talking about a complete government takeover of healthcare. Instead, we need to find the right balance between federal oversight and state and local implementation. Think of it like this. Uncle Sam sets the rules of the game while the states and local communities act as the players on the field. The federal government's job is to establish national healthcare standards, ensure equitable funding distribution, and monitor the overall performance of the system. This means setting clear guidelines for coverage, ensuring that everyone has access to essential healthcare services, and keeping a close eye on costs to ensure they don't spiral out of control. Meanwhile, state and local governments would be responsible for tailoring healthcare delivery to their specific needs and preferences. They know their communities best and can adapt the system to address local health challenges and priorities. This decentralized approach allows for flexibility and innovation while ensuring everyone has access to quality care. Section 4. Public versus private. Why not both? Now, let's address the elephant in the room. Public versus private healthcare. Some folks think we need to choose one or the other, but here's a thought. Why not both? We can learn from both Brazil and the UK and create a hybrid system that leverages the strengths of both sectors. Imagine a system where everyone has access to a robust public healthcare option, just like the NHS in the UK. This would provide a safety net, ensuring that everyone has access to essential healthcare services regardless of their ability to pay. But we can also allow for private insurance to exist alongside the public option. This would give people the choice to purchase additional coverage or access private providers if they prefer. This hybrid approach ensures universal coverage while allowing for individual choice and flexibility. It's about finding a balance that works for everyone, providing quality care while respecting individual preferences. Section 5. Healthcare by the people, for the people. Here's the thing about healthcare. It's not a one-size-fits-all deal. What works in one community might not work in another. That's why it's crucial to involve the public in shaping healthcare policy. We need to hear from patients, doctors, nurses, and communities to understand their needs and preferences. Think town hall meetings, public forums, online surveys, you name it. Let's get people talking about healthcare and give them a real voice in shaping the system. This isn't just about gathering feedback. It's about empowering communities to take ownership of their healthcare. And it doesn't stop there. We need to establish mechanisms for ongoing monitoring and evaluation. This means regularly assessing how the system is performing, identifying areas for improvement, and making necessary adjustments based on real-world data and feedback from the people it serves. Section 6. Waiting for healthcare, not on our watch. Now let's talk about a common concern with free healthcare: wait times. It's a topic that often sparks heated debates and raises eyebrows. The fear of being stuck in a seemingly endless queue, waiting for essential medical care, is a legitimate worry for many. People worry that they'll be stuck on endless waiting lists, unable to access timely care. The anxiety of waiting, especially when in pain or distress, can be overwhelming. It's a legitimate concern, but it's not insurmountable. There are ways to address and mitigate these issues effectively. We can learn from the challenges faced by the UK's NHS and implement strategies to minimize wait times and ensure timely access to care. The NHS has faced its share of difficulties, but it also offers valuable lessons in managing a large-scale healthcare system. One solution is to invest in expanding healthcare capacity. This involves not just building more facilities, but also ensuring they are adequately staffed and equipped. This means training more doctors and nurses, ensuring that we have a robust pipeline of healthcare professionals ready to meet the demand. Building more hospitals and clinics is crucial. These new facilities can help distribute the patient load more evenly, reducing bottlenecks and wait times, and leveraging technology to improve efficiency and streamline care delivery. Electronic health records, for instance, can speed up the process of accessing patient information, leading to quicker diagnoses and treatments. We also need to get creative with how we deliver care. Think telemedicine, mobile clinics, and community health centers. These innovative solutions can bring healthcare services directly to the people, especially in underserved areas. By bringing healthcare closer to people, we can reduce the burden on hospitals and improve access to timely care. Community health centers and mobile clinics can play a pivotal role in this decentralized approach. And remember that private insurance option we talked about? It can serve as a complementary system to the public healthcare framework. That can also play a role in managing wait times. Private clinics often have shorter wait times and can provide an alternative for those who need immediate care. By allowing people to seek care from private providers if they choose, we can create a more flexible and responsive healthcare system. We can alleviate pressure on the public system and reduce wait times for everyone. A balanced approach that leverages both public and private resources can lead to a more efficient and effective healthcare system for all. By adopting these steps, the U.S. could move towards a more equitable and accessible healthcare system. And that is the contentful truth. What are your thoughts on this approach? We'd love to hear from you. And remember to like, share, and subscribe, along with hitting the notification button for upcoming content.